So I've been at the tooth doctor for quite a long time now. I've been there over 9 years. I love working there. It's such a good practice, such a nice place to work. Staff are all brilliant. It's just a really nice, friendly team. I've been doing sedation now for over 7 years. I just love it. I love building up that relationship with patients, helping them overcome their fears. What can be really nice as well is you can get treatment done under sedation, and then you build that trust with them, and they get to the point where they can get their treatment comfortable without sedation, which is really, really nice to see people achieve that. Outside of dentistry, I am recently married. Stay with my husband and our dog, who is just like our baby. And I enjoy going out with the dog, travel, like to keep really fit, do quite a bit of running. Did a half marathon last year, so that was really good. It means that I can treat basically all patients that wouldn't be able to get treatment done before, so patients that haven't been able to get treatment done for years but they've been desperate to get things done. It's just really nice to be able to give them an option to get their treatment done and get more comfortable and start to be happy getting dental treatment done. When they're very nervous, a lot of people, even stepping through the door is quite a big thing for them. They just, whether they've had a bad experience in the past or they're just generally nervous about it, they tend to see some very, very nervous people coming in. They always say, oh, I'm the worst person you'll ever see, but it's not the case. We see lots and lots of nervous people. What's nice is they can meet up with Claudine. It's a lot more informal, so it's not in the dental surgery. It's just sitting, having a chat, going over their fears, their concerns, and just talking about what's actually available to them, because a lot of the time they don't actually realise what is available and what can be done for them. Fillings, extractions, root treatments, crowns, veneers, everything, absolutely anything happens under sedation. Everything, health of their teeth, health of their gums, any fillings that are needing done, needing replaced. We'll show you the x-rays, we'll show you photos if that's something that's needing done as well, and just go over sedation, see if you're suitable for sedation. Spend a bit of time doing that. Any factors that can affect their dental health, health factors, family factors, the health of their teeth, the health of their gums, the health of their bone. Just a really full, comprehensive assessment of the health of their mouth, what is needing done, what needs action straight away. We have a pain-free system for doing our dental injections. First of all, we numb the gum so that you're not going to feel the injection going in. We have a digital injection system that just makes sure that it gets injected really, really slowly, so it's nice and comfortable. The local anaesthetic is nice and warm as well, so it's not going to be slow when it's getting injected in, and it just makes it a really comfortable experience and not painful. Yeah, there's a few ways that you can refer to us. You can send us a letter through the post, you can email us, you can contact us through our website, just attach the relevant treatment plan, any x-rays if you've got them, so we've got them, and then you contact the patient and get them booked in. Probably one of the most anxious patients would be someone who typically would have had a bad experience in the past, really, really nervous coming into the practice, like actually physically shaking with nerves, upset, just sitting in the chair is quite a big deal, and actually getting physically quite upset. Just formulating a treatment plan, taking it nice and slow, making sure we get them nice and comfortable before we do the sedation. Couple of appointments just to get the mouth kind of nice and healthy, and then just what you can see with that kind of patient is each time they get a bit more comfortable because they know what to expect, and the sedation gets easier and easier, and they start to build a good relationship with us, and achieve the smile that they've kind of wanted for a long time but not been able to go ahead with. With regards to kind of anaesthetic not working, the patient's always in control, like there's always that element of control. We would always make sure a patient is numb, but if they ever want to stop or they ever feel anything, they always put their hand up. We would never ever do treatment if something was sore. With the sedation not working, I mean, I've been doing sedation for a long time and that generally never really happens. You always get relaxed enough that you'll be able to do treatment. Plus you don't really remember much about it afterwards, so people always come back and say they can't believe how easy it was and they can't believe that they managed to do the treatment. On the day of the sedation, the patient will come in, we'll go through the treatment plan to make sure they're happy with what's getting done. Check the blood pressure. We've already checked the blood pressure assessment to make sure it's okay. Sometimes obviously because they're quite nervous it is a little bit higher, but we've always put that kind of baseline to make sure that's within a good healthy level. Put the wee cannula either in the back of the hand or the arm, and then it's just a drug that goes into the vein that just makes them nice and relaxed, just almost a kind of almost sleepy state, just nice and happy to do the treatment. Sedation appointment would be somewhere between an hour and an hour and a half, which gives time at the start to get you ready for the sedation, and it gives you time to recover at the end before you leave the surgery. And have a wee chat for a wee while, just make sure we're kind of back to normal, just kind of happy in your surroundings and not as kind of sleepy as you were. We'll make sure you can stand up, just make sure you're so you don't go out looking like you've had one too many pints. We take you out to whoever's taking you home, just go over any instructions with them, and then we discharge you to your escort who can take you home. Just going home in the car and just telling the same story over and over again. Or even in the surgery, they'll tell us the same story at the start and then tell us it again at the end and have no recollection of telling us the first time.